Okay. All right. Thank you, everyone, for joining us today. The Wellness Program is really excited to have Dr. Malcolm here from Cigna EAP, and we're going to be talking about pain and pain management when it impacts your life. I think this is a topic that is probably not talked about enough when we talk about wellness and well-being. I think if you know somebody who's suffering from chronic pain or are yourself, it definitely has a huge impact on quality of life. And we welcome Dr. Malcolm today. I will let her introduce herself, and thanks. If you have any questions, put them in the chat, and I'll also be providing some additional resources.
Thank you. So, and I will try to glance at the chat, but I get really engaged, but I'll make sure at the end I take a look at those. And I'm going to make sure I leave some time for questions. This is a hot topic. So my practice is in the area of health psychology. I'm a clinical psychologist. And a lot of this that we're discussing today is things that I use with my clients. I try to do health education with my clients so that they can own their own health and wellness. So hopefully that's going to be a benefit to you today to really take this in, make it your own, make it personal. Think about yourself in these situations, someone you know, so that you can kind of retain information better. And by all means, sharing the information as we were discussing earlier. So when we talk about pain, it's really important keeping an open mind, because there is so much changing in the research around pain that some of the things that we used to think, and even physicians used to think, and some of them are more caught up with the times, so kind of outdated now. And the good news is there's really good research coming out. So this is not a diagnostic presentation, of course, and I'm a doctor. I play one in real life. No, I'm not a medical doctor. I'm a clinical psychologist, but really you're going to see this huge interaction between psychology and pain and our physical well-being. So new research on MRIs and fMRIs allow us to see the brain in action. And that's how some of the things that are new in this area are going to come to light, because we can literally see the brain reacting to things. So sit back, relax, and let's take a look at what we're planning for today. So let's get a better understanding. And this is something I do with my clients. If you know how it works, you have an idea how it works, you can buy into the recommendations and suggestions. Of course, we'll discuss kind of the impact that folks are having with pain. And then we're going to talk about a lot of range for pain management. Pain management is no longer seen as a one-shot pill or surgery. It's really creating a whole individualized treatment plan. And we'll talk some about being a caregiver for someone with pain. And sometimes you are the person who has pain as well as the person who is taking care of someone with pain. So you can see this from even both perspectives. And we'll talk about EAP. Pain is the most common visit for our PCPs, our main doctors, and a leading cause of disability that we have. There is a major amount of money spent on pain, trying to improve and reduce pain and so on. And for a lot of people, it's a chronic struggle. So hopefully this new perspective gives people hope and gets us to feel better if it's your own pain that you're dealing with. So there's a lot of kind of myths and beliefs out there. And all of us at some time, if you've had pain for a while, any kind of chronic pain, and I'll share with you, I've lived long enough. I call it the price of getting older, that I have a lot of chronic pain issues myself. So it's very relatable for me. And we go through a series of concerns. Is it, is this all in my head? Because, the doctor can't maybe find a reason why you have it, but your pain is real. Maybe I should just tough it out, be less sensitive to it, try to ignore it. Nothing's going to make it better. I just have to live with it. Or if I can find the right treatment, it completely goes away. Certain things we're going to kind of be coming in and out of higher, lower. And is it, the more pain I have, that means that there's more damage. That's not necessarily true as well. And if I take pain medication, all pain medication is going to create addiction. And these are things that I kind of hear from clients that I see, and they are concerns that we have. So if the more we learn about it, the more that we can kind of put some of those to bed. So we do know that there's all kinds of pain, from a paper cut to major surgery. We also know that everyone experiences pain. There is one condition where it's a neurological condition where you don't, and not having pain is very dangerous for us. It is a warning sign. The problem is that pain is supposed to be very simple in its function. You have some kind of a stimuli, you put your hand on a stove or drop something on your foot, or you have an injury of some sort. You are to move away from the source of the injury, and it brings your attention to that injury so that you can take care of it. That is what pain is supposed to be for. Chronic pain, on the other hand, which is really what we're focusing on here, is when you have pain that it lasts longer than 3 months. 30% of the population has some sort of chronic pain. It's gone on for a while. Maybe it started with an injury. Maybe you can identify what happened, hurt back or an illness or something. Sometimes it's directly related to some sort of illness, cancer, or the treatments for an illness, or things like arthritis or normal wear and tear. It's trickier when we don't have a known cause. And that is a little concerning because we can't really pinpoint it. It's a little difficult sometimes with the healthcare system to kind of identify it, and for other people to understand where we're coming from with that. So things like fibromyalgia, which now we're actually getting some new data on what fibromyalgia is about. You cannot find it, identify it necessarily in an MRI or an X-ray or something, but it's very, very real. So we're learning about that. And then it's complex. We know that things are not simple in medicine anymore. There's a biological emphasis, social aspect to it, psychological, and our behaviors. There's things we can do to make things worse, things we can do to make things better. So maybe the questions we should have for ourselves, some better questions to ask is like, what is it that makes this particular pain stay so long? Or what is it that makes us feel it more intensely, makes us more miserable? That would be a better question to do, to kind of focus on then kind of the qualities of the pain that we have. And by the way, as we go throughout, there are some places where you might notice the work that I do. I use a lot of mindfulness-based therapy, and it may show up in the language that I use, being aware, being non-judgmental, because as a treatment for pain, mindfulness is a very powerful tool because it teaches us more about what's going on in our body. So keeping an open mind. There is a biological role in chronic pain, of course, but there isn't a lot of agreement necessarily because we're just learning about what goes on. One of the theories on prolonged pain is that there are changes to our brain, and we feel everything in our brain, by the way. That's why if we have some sort of spinal cord injury and you're no longer getting messages to your brain, you don't feel any sensation, including pain. So messages going from the nervous system through nerve tracts is how your brain interprets the pain. And that's kind of communication, that pathway is where we get some issues sometimes. So knowing that nerve tissues and nerves and these pain pathways can get stronger or they can get weaker, and that changes how we interpret, how our brain interprets pain. So there's this influence from our nervous system, which can make us more sensitive to pain. And having pain can make those pathways stronger. The more messages you're sending on that track, it's sort of like a well-worn groove through the forest. The more you go down that path, the more that groove kind of gets deeper. Good news is we can also stop using that path or use it less often, and then it gets a little bit overgrown and you can't see it, don't feel it as much. So even if we don't have stimulus, we can have pain because it's happening, communication to the brain. In fibromyalgia, for example, pressure is communicated as pain at times. So the good news is that when we kind of deal with that nervous system part of it, if we can learn to relax the nervous system, here's a place for mindfulness and how some medications also work, that those pathways can return to normal. Sometimes they can learn to normal as we manage our pain. Inflammation is highly overlooked, and this is something I always check with my clients on, because inflammation is going to put pressure on tissues. And if you've already got something going on, or if you don't, it causes pain. If you've ever sprained an ankle and you've gotten all that swelling, you feel the pain from the swelling, that's big inflammation. But we have kind of this chronic low levels of inflammation in our body that release some chemicals into our tissues in our body. And this can cause that kind of low grade problem, but that impacts the nervous system, affects the nerve tissues, and increases our intensity of pain. So genetics are also very important. There is research that shows that there may be some genetic markers that make you more susceptible to perceiving pain. And there's also environmental things, also family, how family perceives pain, people around you perceive pain, and so on. Currently, there's no gene therapies for that kind of pain, but we are learning more about it, so keep an eye out. So the problem with chronic pain is that it kind of becomes this very vicious cycle. You have this pain, and then how we respond to that pain tends to make it a little better or can make it worse. And here's where the biology contributes to it, because if we have pain, again, so we get that increased sensitivity to pain, that then leads us to some behavioral things. We might avoid activities, and culturally there's an influence here too, family culture and greater culture, that don't use it, don't move, don't do exercise. And inactivity is actually harmful for us when it comes to improving mobility and reducing pain. And then the body gets weaker from disuse. If you have pain in a joint, for example, like back pain, that's the condition I've had since I had a car accident at 26. If you don't strengthen your abdominal muscles, your back has no support. So this idea that I shouldn't do any exercise because of my back is actually making my back more susceptible to pain, and also makes us have more inflammation. The body needs movement. That's how blood gets moved around, circulation, and so on. This is a realm where I work, and I have seen a lot of issues come around the psychological factors as it relates to people experiencing pain, and also the caregivers around them. So chronic pain is not all in your head. When we talk about psychology, we're not talking about, I'm just thinking it, and just because I'm really thinking I'm doing this to myself. Because I hear that a lot, or I hear people who say that about their relatives. It is in your brain, however, as we mentioned before, and our emotions impact that. Our brain is also the source of all emotions, and so on. So when we get into falling into depressive episodes, or having anxiety, or catastrophizing, these are things to literally lead to increasing the experience of pain and worsening pain conditions, because these things are also neurobiological. They work on some of the same pathways as pain, so they can work as that magnifier in the brain. 50% of people with chronic pain experience depression and anxiety. There's this bidirectional relationship. So pain can cause depression, anxiety can cause pain. So when we treat depression, anxiety, we're actually treating pain in the process. And I have a lot of clients who will report that. They'll report less migraines, for example, or less, just achiness, and so on. So the same chemicals that are released, some of the same chemicals that are released when we have, think about it, emotional pain, still pain, are very similar to the chemicals when we have physical pain. So one of the things that may happen, doesn't have to happen, but that may happen to folks, is that when you have pain, especially chronic pain where you're not really getting the answers that you need, or the relief, that we do tend to kind of catastrophize and think, this pain is never going to be controlled, or that this pain means there's ongoing damage, whatever's wrong is getting worse, or even have thoughts that, this pain's going to kill me. And it's natural for our brain to kind of think that way. One of the things in the world of stress is your brain is always looking out for threat. So we don't judge, that's mindfulness piece, we don't judge that our brain has these thoughts or these responses. What we want to do is rein it in, really listen to our thoughts, and try to realize that we're even having those thoughts. A lot of times it's just below our awareness, and then we want to interrupt those patterns and get better information. So we may spend a lot of time thinking about the negative effects. How is this going to affect my future, my job, my relationships, caring for my elders and or my children, and so on. Problem with catastrophizing is it comes at a high cost. It creates more intensity of pain, and then it might make you even more conscious about that pain, which then makes you, again, back to avoiding certain things that might be helpful. So biological factors can feed into it, but we also have a psychological vicious cycle, which is we get pain that naturally makes us anxious. We might fall into catastrophizing. We know those pathways are there, so we have more pain, avoid activities, and then we might fall into depression. And then we keep going around in this circle and it keeps intensifying. So we want to catch it and interrupt the patterns. As everything is complex, it's not biological only, psychological only. We are social animals. The way that our brain is wired is we feel safe when we are feeling supported by other people. Human beings are weak animals. We die alone in the wilderness. So having social support is important. But sometimes in chronic pain, some of this social support, the fabric of our social support can get altered. One of the things that can do is it puts strain and stress on us, not just on our body, but it makes us more alert. So it might kind of keep us in a little bit more of an anxious way. And we know that anxiety also affects our emotions, and it might make us more irritable, or it might make us shut down if we're feeling overwhelmed, which those are things that are going to trigger us to maybe interact differently with the people in our lives. So we want to learn how to cope with our stress, because not coping with stress, and I hear you have some great programs for this as well, it increases your pain sensitivity. Stress is also part of the limbic system, still part of the brain where we sense pain and so on. It makes us hypersensitive and leads to that avoidance. And it also interrupts with our sleep, which is something we seriously need to get on track for pain. And I know I've had pain issues that have interrupted my sleep, and I've found some solutions for that, and in the ways that we're going to talk here in the presentation. But sleep also is part of these pathways. It's connected to the same pathways as pain, as depression, as anxiety, and that's why we get sleep difficulties when we have those conditions. They're all uniquely connected in our brain. Sometimes, the people that we have in our lives that we need to support us, sometimes they can actually be part of the reason that we have more stress and anxiety, because especially if you have chronic pain and there's no marker, nothing that we can tangibly show them on a MRI or something, that people may start to feel that it's all in your head, or they may be struggling to be supportive. I've had cases where I have someone, they went through a catastrophic illness, and their family that cares for them is really struggling with the fact that they cannot do the things they used to do. They tend to tell my person that they're being negative, you're being negative. They're not really seeing the whole picture of what they're capable of doing, not capable of doing. So we can get this from not just, our friends and family, but unfortunately, sometimes healthcare providers may not be as well informed. Just like anything else, psychology, whatever your job is, some folks are more in tune to what's new and going on, and some people may not be as much. So particularly when it comes to the healthcare environment, if you're not feeling like you're getting the help that you need, or you really want to look at this holistic approach that we're talking about, I'm going to give you some suggestions later on ways to get kind of an integrative, a team working with you. So keep that in mind, and working with people who are really kind of up to date on this. Look for people who specialize in pain as well. So we also get some positive reinforcements from the environment. I've seen this personally with family members, that part of what was happening is roles were shifting, and the person that was in pain kind of was kind of reinforced to stay there, because they were maybe getting respite from responsibilities. Maybe they weren't getting the support they needed before, and then having this condition is kind of giving them more sympathy from their loved ones. And it changes our schedules, our routines, and sometimes our responsibilities. I literally had a person that I worked with a few years ago who was a caregiver for another family member. This person was so overwhelmed that they actually had a car accident and injured themselves and were not able to get out of bed. And sadly, they said, this is the happiest I've been in a long time, because I don't have to do anything. So look out for some of the reinforcement that may be we're getting attention, and so we don't necessarily want to let go, and we're in pain, but we're getting that support, and that's natural. No judgment. It's natural to maybe go there. The flip coin of this is that we cut ourselves off from others. I had a young person that I work with who had one of these undiagnosed conditions. One day they were fine. They literally woke up and they had this terrible pain that took months to kind of determine what was going on, and was not going out, was not seeing other people. At one point severed the relationship with their significant other, which left them with less support. And really part of the work that we did was getting them back connected with people. Because what happened is most of the things this person enjoyed involved doing it with other people. So they were spending a lot of time kind of by themselves, and the only other companion they had was their pain. So we can kind of fall into that. So we want to be able to, understand that sometimes some folks may also kind of move away from you. That's normal too. We don't want to judge other people. They don't want to see you suffering. They know kind of how to handle that. So communicating with them so that you can give them some, tips on things they could do to be helpful, or, noticing, when your energy is better, so that they don't just kind of like stay away because they really don't know what to do. And then you get kind of left out of things. So vicious cycle here again. Pain kind of does limit your ability to maybe participate, like my young client, in some of the things he used to do. And it changes our roles, like the other person I mentioned. And then we get more emotional turmoil because we're on our own, dealing with nothing but pain, and that increases stress. Vicious cycle, we're back to increasing pain. And the final piece is our biological contributions to pain. And this is an area, because I get a lot of folks with just the kind of stuff I'm mentioning. Nobody can figure out what the pain is. And a good physician says, I think maybe you should talk to someone. And in that process, this is one of the areas that we also work in psychology, especially if you're focused on health psychology. It isn't just talking about emotions or what happened this week. It's about, and using mindfulness, for example, is really getting to know your body, so we can understand, maybe we can interrupt some of this. Maybe some of the things we're doing can help us. So it's easy when you're feeling pain to feel that you have no control over it, but we actually do. We can do things that actually feed into it and make the pain worse. And we might do some self-limiting behaviors, like we talked about with physical activity or social behaviors and so on. And that kind of, we kind of feel like nothing works. So we also might have some self-limiting behaviors that say, look, nothing's working, so I'm not going to go to any more doctors or try any of these holistic approaches. So keeping ourselves limited. There's a lot of change in the research and in medicine happening these days. So really, if you've been experiencing pain and it's been a while since you go and have someone look at you and kind of try these approaches, go ahead and get out there, because it can make a difference. We talked about the self-isolating, and it may make us more likely to have pain increase. We may also self-isolate and kind of try to do more than we should. I personally was guilty of this once. I had a procedure and was very stubbornly not allowing anyone to help me, and managed to set my recovery back because I didn't want to, ring a bell, call for help, make a phone call. So keep in mind that we kind of allow people to care for us in an appropriate balance of self-sustaining ourselves, but really getting the help. This last place is a place that I work a lot with my clients in health psychology. Some of the habits we use for coping, and not just with pain, these are habits we develop for coping with, stress and emotional and heartache and everything else. We can tend to overeat. I can't do the things I enjoy, so I'll enjoy eating. We can stop exercising, of course. We might turn to alcohol or substances, or we might use things like kind of vegging out on the internet and social media to kind of not feel anything. Those things are also going to feed into the vicious cycle, because we're developing poor habits for coping. In the meantime, we're not getting skills and learning new habits for coping. And that, again, disuse, disability, and depression. And the physical body isn't the only part of pain, as you're seeing. Our mind plays a role, our social connections, our environments, and our behaviors. And if you think about these 4 areas, we actually have a lot more impact, because if we're doing, like putting together a nice menu for a meal, you want a little of this, a little of that, make it colorful. These 4 areas are places where we can kind of get into it. So if you suffer from chronic pain, then you already know these things, but the impact of living with pain and these factors that contribute with it, again, sometimes we may be slower to heal with things. Your nervous system is different than someone else's. And keep that in mind if you're a caregiver, that just because something that they're experiencing wouldn't hurt you, their sensitivity is, their brain is interpreting it differently. We can get a lot of disabilities that limit the things that we can do. It can make changes in our personality. Being in pain all the time, your brain interprets that as a physical threat, and therefore our fight or flight, that irritability or the shutting down or freeze, that might show up. So you may see it in that way. And we talked about the emotional aspects of that, developing frustration or negative self-talk and self-esteem. And again, cutting ourselves off for people or really getting frustrated, because when you're going through chronic pain, you can feel like you're alone, and that might strain relationships. People may say things or do things and may feel insensitive. They're talking about going on a trip or vacation and something that's not available to you. So being mindful of your response so that you can interact with people differently, and say what you need to say, but being able to process things so that it doesn't affect you as much. And we know that it has a huge financial cost at times, because we may be missing work or healthcare costs. Some of the things that we're going to talk about are not always available, and we may have to do some things out of pocket, but some of them are actually maybe included in wellness plans. So really looking into, when I was talking to Jane, you have a lot of wellness plans that you'll see that very neatly with the management of pain. And there are things that we can do that are actually free out there that can help us. So we're going to shift from the bad news. Sorry, I have to do that. But we're going to shift to kind of what is pain management and what are some ways that we can approach it. So there's a lot of things, as you saw, go into the experience of pain. And really keeping in mind, there's no single pill, no magic bullet, that we really want to get that menu and tailor it to what's going on with us specifically. So learning about these strategies we're going to talk about and implementing them. The main goals of pain management is really to help you have a positive impact on your life, decrease the sensation of and perception of pain so we can do things we enjoy, be with people we enjoy. We want to decrease physical, increase physical function so that we can be out there, we can work, we can go on vacations, be with people that we care about. And lastly, that enjoyment of life activities. So when it comes to pain perception and reception, like I said, that's in your brain. The degree of focus that our brain has on pain has an impact, and we can use our awareness of that to help relieve and improve it. We may not find a cure, but we can shift. I'm sure that some of you have experienced, just to give you an idea how our pain perception works. You're out on the dance floor, you're having a great time, or you're out, if you're sporty, you're out doing a sporting event and you've got an injury. But I've been dancing, those blisters on my feet, they start from day one with those bad shoes. I'm lost in the music, I'm connected to the people around me, and I am having such a good time that I know it hurts. There's this little nagging message, but it's so muted that I keep dancing and I make it really, really bad. The minute the lights go on, the music goes off, I cannot walk to my car. The pain is excruciating. The blister didn't just happen. The damage has been done for the last couple of hours, but my brain wasn't receiving that. So that's when we talk about sensation and perception. It's not about me paying attention. It's about having other things in my neural pathways, in those pain pathways. Having some pleasant stuff will kind of counteract that. The more that we are inactive, the worse we get. The worst thing I can do is sit in this chair for a few hours without moving. And I bet you know what that feels like. Your joints need to move, need lubrication. And activities that we enjoy, like I was saying, when you're having fun, enjoyment, and feeling good, that's working on the same pathways. So there's pain sensation and there's pleasure sensations running on these same sensation tracks. So when you're doing something enjoyable, perceiving something enjoyable, it actually makes a difference in the messages, because the pain isn't the only one going up there. You've got some good stuff coming through. So in order to break this cycle, you got to kind of check in with yourself in a kind of a mindful way and to see how ready are you for change. You know, how open is your mind to trying and exploring these new options. I'm going to give you some ideas here. That is going to put you in a position to really be successful in your own pain management. First, you want to have the self-awareness kind of to break this vicious cycle of not really knowing what's working and what's not. Pain is rarely the same the whole time. It gets better, it gets worse. The more that we are aware of that, of our whole being, of that emotional, those other factors and how they're interacting, the more we then have knowledge that allows us to make a change. So understanding emotions that it might be happening. Am I angry? Am I sleepy? Am I acting out? Am I giving up? How are your responses, to this pain? What is it emotionally, physically, and so on? Listening to that self-talk, if you hear a lot of that negativity and judgment and so on, how does that make you feel? How does it affect your pain when you get into the kind of, listen, it happens, we get into that kind of rut, right? And then if we're able to use mindfulness skills and really get connected with our body, we can identify pain triggers. I noticed, for example, that if I have, my favorite thing in the world is ice cream. If I have ice cream every night, which was a habit of mine, okay, it's a bad habit, but and I realized that sugar is something I'm very reactive. My arthritis does not like sugar. And so I noticed I stopped having it every night. The way that I stopped was I realized I could sleep better at night. I had less pain. I wasn't waking up as often. That acted as a reinforcer for that very good habit of not having ice cream every night. But I realized I had some control over it. And that's very powerful. You start to find other ways that you are. So we create some good habits to deal with it. Things like managing our weight better, not staying up late, and maybe avoiding things like caffeine, sugar, too much sodium. These are some of the things that we often don't even notice that they're really making that pain go higher. I always use a scale with my clients on 1 is no pain and 10 is a lot of pain. And I tell them, get in the habit of checking in with activities you do, what you eat, and so on, and see what makes that number come down, what makes that number come up. That makes you feel in control. And then be willing to try some alternative methods. We're going to talk about those. So really important in this fight against pain to tap into all the assets you have and notice what works. Some things are going to be better than others. And the handouts that you have, there's a journal so that you can do this kind of tracking of pain and what works and what doesn't to really get in tune with your own patterns. So pain in your body. So I know it's not a mindfulness presentation, but I'm going to do a brief, and this is going to be really brief. You're going to see how quickly we can kind of make some assessments. So I want you to take a minute and just get plugged in. If you would, get comfortable, first of all, and just closing your eyes, or you can drop your gaze, and then just shift from kind of the awareness of the presentation to feeling of being in your body. Just notice where the body sort of ends and the rest of the world is. So maybe tap your feet, notice sensations on the floor, your back in the chair, your bottom in the chair. Maybe the sensation of, the air on your skin. Taking a breath and notice the sensation of the breath coming in now, just movement. Now I'm going to ask you to do a scan of your body. And this is going to be a relatively quick scan, but you're going to go from the top of your body, from your head, and you're going to go to your toes. And anywhere that you notice any discomfort, tension, or pain, I want you to just note those things as if you were doing some sort of an MRI and just kind of color them red and just kind of notice as you're going from your head down through your neck, through the torso, the hips, through the legs, all the way to your toes. Let's get a general snapshot of all the areas in red that you just found. And on a scale of 1 to 10, where 0 is no discomfort, tension, pain, and 10 is it's pretty intense, just kind of all those red areas, give it an overall number where you are right now. Taking another breath and connecting with the bottom of your feet. This time I'm going to have you scan from your feet up to your head, but I want you to notice and color blue any areas that feel pleasant, that feel neutral. And if in any of those areas where you might have colored red, if you can find some edges where maybe it's just a little bit of tension, it's not really pain, and you can color those blue too. So going from the bottom of your feet, color the pleasant, neutral, blue through the legs, the hips and the lower torso, the upper body, neck, through the face, all the way to the top of your scalp, and pause there and reflect back. And take a snapshot of all your blue areas. And checking in on a scale of 1 to 10 where your level of discomfort and so on is. And maybe it changed, maybe it didn't, but just checking in with that. And maybe at the end you can tell me what that was like. So you can open your eyes and kind of wiggle around and bring your attention back to the presentation. So mindfulness is one of those things that is very helpful for connecting and helping us manage pain. Part of what it does is in mindfulness, we diffuse kind of some of the emotional things, some of the mental and physical manifestations of stress and pain in our body. We're really paying attention to what's happening right now. Sometimes our brain is thinking, kind of magnifies what's happening for us because it's focusing on it. And meditation, we're trying to pay attention to whatever's present. It can be your body, sounds in the room, food that you're eating. You could walk, you could sit. There's a lot of ways of kind of bringing yourself into the present moment. And it calms us. It has a calming effect, releases some of the good neurotransmitters like oxytocin and dopamine that are feel-good neurotransmitter, and release tends to decrease your overall sensation of pain. So it has an impact on our nervous system. And again, we see that on MRIs and fMRIs that it can very, in the moment, cause a reduction, and over time with practice can quiet those pathways that we've talked about. Another powerful tool is distraction. We can use things like guided meditation. When we do that mental vacation, you imagine very vividly being on that vacation somewhere, relaxing and chilling. We can do that by getting massages, listening to music, going for a walk in nature. I hear you have some great programs for that. A warm bath, getting lost in those sensations, or pretty much any pleasurable activity that kind of lets your mind focus on something else that's going on in the moment. I like to think that you can be distracted, but in this mindful way of really taking in information. For children who might be suffering from some pain, storytelling is a great way of distracting them. And mindfulness works with them too, by the way. Counseling does as well, understanding this relationship of thoughts, beliefs, emotions, how memories and our past experiences might be lending themselves to the pain. If I'm, I have a lot of folks who've had childhood adversity, and if the pain that they're feeling now, they're not able to care for themselves and they have to rely on someone else, that might not be an experience that's very comfortable for them. And they need to be able to trust the person who's caring for them and know that these things may be coming from the past kind of to get in the way. We already talked about those negative thoughts, and we can use cognitive behavioral therapy to kind of learn to shift our thoughts to something more realistic. So keep that in mind. So when we're doing that, when we're working through pain and our emotions, we're actually actively building our emotional strength, our ability to be more resilient. We can get very exhausted from pain, but also from the emotional aspects of it. So getting in touch and having awareness of what these emotions are and really adapting and thinking about what's actually going on right now helps us to focus on the here and now. And other things that we can do is noticing small changes. Today was a good day. I didn't feel as much, or having gratitude for some of the things in your life, like someone caring for you. These things tend to give you a sense of control looking for the positive, and so on. So have a trusted provider. Like I said, not everyone is going to be as well versed in pain management. So you may have anger and restlessness and feeling alone or struggling really because you may not be working with a provider that is good for this situation. They may be good for other situations. So having good open dialogue with your healthcare providers, letting them know if there's any medication side effects, letting them know what works, asking them about alternative help that you might get, and building that support that we have with them and also other people that might be suffering from similar situations. For example, the American Chronic Pain Association, which we have in our handouts, they offer support. Other people understanding what we're going through is helpful. And of course, treating the anxiety and depression as well. So how we actually can get involved personally in our success is setting realistic goals for ourselves, really working towards small bite-sized goals. Don't overreach so that we cannot hurt ourselves, but actually see the success. Get a variety of strategies going, and notice when you need to adapt. Just because a recommendation was made by a doctor, physical therapist, it's not working, communicate with them. Commit to allowing other people to kind of know how you're doing. Know kind of like, what do you need to tell them, how you're experiencing a situation, and especially if with people who care for you, how can they help? People might be doing all the wrong things, and I've had people get really annoyed because people in their lives are overprotecting them maybe and not doing that thing they need. But then I work with my client, you really got to kind of tell them. Get out of the all or nothing thinking, because we have to pace ourselves. When it comes to certain chronic pain, you want to take it easy, small steps to get to learning how to manage it. You might be trying something and all of a sudden you went too far and you decide that's not for me, it didn't work. And really it's not that it didn't work, it's how much we might have done or how little we might have done. So over time, getting physically active is going to build up our stamina, and that's going to make you feel that back in control, back into living my life. So noticing that, make sure that you include rest as a very important part of that stamina. So I have the overambitious people who push it a little too hard and they're not getting enough rest or listening to your bodies. It's not, this is a classic, it's not a race, it's a marathon. It's an ongoing marathon. So you want to work on that. And we talked about the healthy weight, because not only are we looking for eating in a way that doesn't cause more inflammation, but also healthy diet gives you more energy to do some of these things, and also puts less pressure on your tissues and joints, which a lot of our long-term chronic issues are kind of come from living a long life and having, creaky joints and a little arthritis, speaking for myself. These are all wonderful. I have used some, not quite all of these, and all of these work. So again, you're building that menu. It's like going to a restaurant and picking, different things. When you have a buffet and you can eat exactly what you want, you don't take everything, but try everything. You might find something you really love. So really, CAMs or holistic medicines, complementary and alternative medicine, is about looking at the person as a whole. We're not just looking at your pain, we're looking at mind, body, spirit. Spiritual practices can also be very helpful for pain management and relief. So we may have a decrease in pain when we do these, improvement in function, and relying less on medication. So things from guided imagery that I mentioned before, hypnotherapy, not the kind you see on the cruise ship where it makes somebody quack like a duck, but a licensed hypnotherapist. I take some training in this, super powerful. Massage therapy, find someone who is licensed massage therapist, and sometimes you call the massage schools to get someone who's certified in a certain type of massage. Oncology massage is different. Neuromuscular for people who have nerve damage and so on is different. Also things like relaxation, biofeedback. Migraines can be treated with acupuncture. People discount acupuncture and don't realize it is one of the most rigorously researched holistic approaches out there. Remember, it was being used in the Eastern medicine many thousands and thousands of years before we had even our medicine. Things like Tai Chi, which include meditation, movement, very gentle, really getting to feel your body, and exercise, even though like with folks with fibromyalgia, it may seem counterintuitive. And please look into mindfulness and other, yoga related and things. All of these are benefits. So there is a place for medicine in all this. And I know we kind of left it here at the end, but medications do work. They're not a magic bullet. Part of what we have is an over reliance on medication, and folks are getting medication. It makes you a little better. That's the time to do these new things. We usually try medications and expect it to work, and maybe over time it doesn't, because we're not doing those other things to keep ourselves healthy. So it's not always going to give you complete relief. Make sure you're using it as it's directed. Too much, too little. I know people who take that pain medication, they're told every day, they take it once in a blue moon, and they go to the doctor, oh, it's not working, and they're not really honest with their doctor about how they're taking it, or they're taking too much. And sometimes too much of a medicine can cause inflammation, for example. So we're not helping ourselves. Some of these medications, if you've ever taken something like gabapentin, which works on those nerve pathways, may take 3, 4 weeks, 6 weeks, to a couple of months to work. So ask your doctor how they work, give it time. And if you're having any side effects or any unusual reactions, please talk to your doctor right away. I know a lot of folks are worried about addiction with pain medication, and there is a risk with certain types of medications. There's a 3 to 27% of people, the research isn't very clear, do have problems with addiction around it, but not every medication is addictive. For example, gabapentin, something like that is not addictive. You are at greater risk for addiction if you've had a problem with addiction in the past. And I would also say, because of the way our brain works, if medication has caused a problem for someone who's a blood relative of yours, that may also be an indication. And also, if you're taking those herbal remedies, talk to your doctor. They might have an interaction. So a true pain management team or professional, these are people who are specifically trained in pain management. If you to referrals, if they don't already have it in their location, they have referrals for this pain management, for the acupuncture and other things. So they might be able to help you to get more realistic goals and mix it up for you. Be careful though, because not everyone that says they're a pain clinic is really reliable or legit even. There are places that are just pain mills. So if you're looking at somebody's website and you're not seeing kind of this holistic mix, you probably want to look elsewhere. And don't forget yourself. If you are supporting someone with pain, this information that we learned hopefully has helped you to kind of see it from their perspective, learn about it, help them to get more information as well. And remember, you kind of learn what to expect as far as their recovery. So develop an awareness, back to being mindful of how it's impacting you. I have had caregivers who are making themselves very ill, trying to do absolutely everything for the person they're caring for. I see that a lot with my clients that are taking care of their elders, and you can't take care of people unless you're there. So find support for yourselves, talk to someone, and take time to do these healthy things that we've talked about also. So keeping open communication with your person you're caring for. If you are overwhelmed, you need, and again, don't wait till the emotions are so high that then it's kind of hard. So it's a vital part of that. So finally, sometimes courage is that quiet voice at the end of the day saying, I'll try again. Don't give up with whatever you've been doing. Don't let the people around you give up with what they've been doing to manage their pain. There's a lot of help and a lot of changes. So I hope this gave you a lot of ideas today to help you out. You can use your EAP program. You have up to 6 individual sessions in your program, face-to-face, confidential, and prepaid. You can call the EAP line, but you all, I hear, have your own consultant on site, which is even better. They can give you all kinds of information and resources. That's something that a lot of places don't have. It's very valuable. You also have 24-hour online, 7 days a week, every day, every hour of the day. You can call the hotline, the the EAP line, and that's going to give you 20 to 30 minutes of a conversation with a licensed professional, so they can answer questions for you about, some basic questions, and then lead you to folks that can help you. This benefit is household. You don't have to be on the Cigna plan. So if you're on your spouse's insurance or someone lives you that's not related to you, as long as they live in your home, they can access these services. You also have work-life support. This is an area we get a lot of stress, elder care. If you're a caregiver with a pain person, you probably have that going on. Childcare, pet care, convenience services for travel, reservations, repairs on your home, check them out. And then lastly, 30 minutes of financial services and 30 minutes of legal services. So this is such an underutilized, I hear from the folks at Cigna that it's such an underutilized benefit, your EAP. So please talk to your consultant and get their help on here. I see a question on the chat. So is there a licensure of some kind for acupuncturists? Yes, absolutely. Most an acupuncturist should be someone, and I believe they are licensed as in Eastern medicine. So they're probably acupuncturists. They also have training in with herbs and so on. And that's actually, there's doctoral kind of programs for holistic medicine. So you can find people that actually have their degree in internal medicine, integrative medicine, which combines a lot of different modalities. So they either do it or they know someone who is. I know here locally, our Memorial Hospital has an integrative medicine department, and there you can get your acupuncture, your massage, meditation, and they work closely then with the PCPs in their system to get more information. So you always want to ask and you want to look it up. Yeah, Jen said, look that up. Thank you. There are chiropractors who offer it in their office. Yeah. And you can check to see if it's covered. Acupuncture, if you tried it before and it wasn't covered, check now, because more recently, because it's being researched, the data supports it, that I believe that's becoming a benefit in some insurance plans. So you might want to check and see if it is or it isn't. But it's definitely kind of worth it to try. If you're in chronic pain, try it. Remember, if part of it is if we can get those pain sensation pathways to kind of get quiet, we're retraining them to not be so sensitive. So sometimes there may be some things where you have to pay some out of pockets, like, other things like there may be mindfulness, like mindfulness-based stress reduction. That's an 8-week program of mindfulness. There may be things out that may not necessarily be part of an insurance plan. But you all have access to it through your wellness programs here, but there may be other things that you should check into because you want to really reduce that pain so that you can turn those pathways off. And when you do those kind of things, you learn skills that you keep, even if you don't have to go to a meditation class anymore. You learn to do it on your own. So definitely the link for your meditation Mondays is up there. Take advantage of that. And I know that Jane wanted to tell us a little bit more about what you have available.
Thanks. I had to find my mute button as I'm like
I know.
going through and posting all these links for you in the chat. Yeah, as you can see in the chat, I did post a link to Meditation Mondays. You can find information on the times and the Zoom links to join us. It's only 15 minutes. You can drop in, you can register. It's pretty low key and a great little refresh or a great start to your day. We also have, obviously, some physical activity is really important to help with pain. We now have an introduction to movement class. This is offered through our wellness center in Clearwater. I posted not only the schedule, but the class description on there, and then you'll want to just take a look at, we do require some pre-registration and that information is there. That's a great segue into just getting some movement in if you're not quite ready, to go big, right? If you just want to take it slow, that's a wonderful class. Let me see what else. Okay, so we talked about gardening as another form of mindfulness and getting a little physical activity. So I will actually just post our wellness classes webpage in which you will be able to find a list of all current classes that we offer. The ones that are currently open for registration are float up to the top. And then as we, most classes, we do offer video recorded versions. So you could see the Florida friendly landscaping. That's our Gardening for Life class this month. We will be offering more, so stay tuned. Those are always really popular. Let's see, as you scroll down, you will find recorded other gardening recorded. I'm sorry, I'm like probably making you dizzy scrolling, but this is where we have a lot of the recordings for previous classes for mindfulness. Here's the Garden for Life webinars. And then we also sleep, right? Huge impact. So just wanted to share those with you. We've got a lot that we offer around just feeling better. So we hope you take advantage of them.